I was assigned with the task of choosing a key player, official or unofficial, in the policy-making process related to welfare, as well as identifying what I think motivates them and who I think has influence over them. A few of my classmates identified money, and I can dig that. Money definitely speaks the loudest when it comes to policy, and if we follow the money trail, I believe we will find that no key players in this game, official or unofficial, are impoverished. I would like to touch on media as a key player in the policy-making process, however, because I find it interesting how the assigned readings described media as both influential and ineffective. I believe media is extremely powerful in all of this as it is how most of us receive or do not receive our information. In other words, it is how most of us get or do not get information. While media's intensive period of sensational coverage, when there's something major, may dilute impact, I believe it does a good job of shaping and not shaping the general public's view of the poor, and shaping and not shaping issues and policy that affect all of our lives. Media sources have successfully reinforced a negative image of the poor, based heavily in liberal ideology. So much so that even poor people wish to disassociate with poor people and blame themselves versus taking us nowhere fast policies. We are indoctrinated by media via institutional actors who have been influenced by interest groups. Media trains us to be complacent, passive actors in a game where we, the people, really hold most power. Why is it that media, particularly news reporting, can get our attention so well, but only really does so when the feces has already hit the fan? Why not take a more active or preventative approach? Because that would cost key players a lot of capital. I know we're supposed to speak about welfare and TANF here, but let's consider the power media has to encourage healthier eating habits. More Americans suffer from chronic illnesses related to diet than ever before. Healthcare is a really hot topic right now. Should coverage be universal? Should coverage be universal? Should it cost more for those with chronic illnesses? Should agencies have to provide coverage for those suffering from pre-existing illnesses? I could go on forever. All the issues surrounding healthcare seem to surround cost and or how to get people costly treatments, but shouldn't we rather be focusing our attention to improving the health of Americans and speaking about how we've come to this? Poor nutrition is proven to lead to poor health. Hypertension, blood pressure, diabetes, heart disease, cancer, and osteoporosis are all diet-related chronic illnesses that can be prevented. According to the National Cancer Institute, 3 out of every 4 Americans die from such illnesses. Interestingly, people do not have to suffer and die from these diseases at all. Nor does the government or taxpayers have to pay enormous amounts of money or require large sums of debt to treat them, if we just eat healthier. So why doesn't media and its key players take that preventative or a preventative stance on this issue? According to the Federal Communications Commission, per Nielsen Media Research, 99% of American households have a television in them, and the average child spends 4 hours a day viewing it. This is troubling, particularly as diet-related illnesses are on the rise, as are commercials marketing fast food and processed foods, which, according to the U.S. Department of Agriculture's dietary guidelines for Americans, are the most sodium-containing foods. The estimated daily sodium intake for boys and girls ages 2 to 3 is approximately 2,100 to 3,200 milligrams per day, when the recommended daily intake for this group lies somewhere between approximately 1,000 and 1,400 milligrams per day, according to Mayo Clinic. Troubling, is it? I'm just going to say that again. The estimated daily sodium intake for boys and girls ages 2 to 11 is approximately 2,100 to 3,200 milligrams. but the recommended daily intake is really somewhere between approximately 1,000 to 1,400 milligrams. This is troubling. Media has the power to report this information or not. Media has the power to decide not to promote or advertise for McDonald's, Tyson, and other corporations advertising foods containing large amounts of sodium. It makes sense to me that if they did stop advertising for these giants, no pun intended, and begin marketing non-processed foods as tasty options, then poor nutrition would drastically decline, poor health and the prevalence of these poor health-related chronic illnesses would decrease, and overall the health of the nation would improve, which could finally wind up the unnecessary healthcare debate so we can focus on the next concern. Some will question if media has this type of power. I say yes, but money talks louder than me. Unfortunately, there are a small number of corporations controlling everything we watch on TV and read in the paper. A lot of power is in the hands of just a few, and they are all invested in our poor health, poverty, and passivity. They all pay big bucks, usually our hard-earned money because we give it to them, to keep it this way by influencing institutional actors to keep media deregulated. This is why there is no diversity of viewpoints on television and no neutrality in the distribution of information. Media is the greatest player in the policy-making process. It reaches the most people and does a great job of training our views, not presenting alternative opinions, and sustaining inaction surrounding issues and policy that negatively affect the majority of us. Again, media is the greatest player in the policy-making process. It reaches the most people and does a great job of training our views, not presenting alternative opinions, and sustaining inaction surrounding issues and policy that negatively affect the majority of us.